Hello and welcome to the Systems for Action Research in Progress webinar. My name is Chris Lytle and I'm Deputy Director of Systems for Action. For folks new to the program, S4A is a national research program of the Robert Wood Johnson Foundation, housed here at the Colorado School of Public Health. We support studies across the country, testing tools and models to facilitate multi-sector collaboration across medical, social, and public health systems with the goal of improving population health and advancing health equity. Today, I'm excited that we'll be hearing from a team headed up by Drs. George Nafal and Emily Neisser of Texas A&M. They'll discuss how they tested reducing criminal justice recidivism and improve health outcomes by coordinating health and social services for justice-involved young adults. And of course, if you have any questions for our investigators, once George and Emily present, we'll have a quick commentary discussion from Jeff Burkhardt, followed up by Q&A. So please enter any questions that you have in the Q&A box, and we'll have time to answer those questions at the end. George Nafal is an assistant research scientist at the Public Policy Research Institute at Texas A&M University and a research fellow at the IZA Institute of Labor of Economics. George is also a visiting scientist at the Center for Outcomes Research at Houston Methodist. Emily Neisser has over 10 years of research experience as a project director at PPRI. She has collaborated on projects in a range of disciplines, including public health, education, and criminal justice. And of course, you'll have access to learn more about our presenters. You'll have access to these slides after the presentation. And with that, I'll hand it over to our presenters for today.
Hello, everyone. So my name is George Nafal, and thank you, Chris, for the introduction. I hope everyone is doing well. What we're going to do today is we're going to spend the first few slides, give a quick refresher on the research question and objectives of the study, and then discuss some of the obstacles we face in the last few months, and also end on a positive note with some of the achievements and up-to-date progress. In terms of, let's see if this is moving. I'm trying to move the screen. Okay, yeah. So in terms of the research questions, we had two specific questions. Does a community-based services program led by team-based decision makers improve emerging adults' physical and mental health, ultimately to reduce recidivism or new criminal activity relative to the current criminal justice system? And that research question is going to be answered by a randomized controlled trial. The research question is also complemented by a study of process eval. What are the features of the program that are driving these outcomes that we are seeing? How has the program changed over time? What are the hurdles and obstacles, and what can be done in the future to address these? As a quick background in terms of context, the criminal justice system, there's more evidence that is failing emerging adults. Emerging adults are those who are between 17 and 24. Sometimes you actually even see that between 17 and 30 years old. They, in Texas specifically, they make up around 10% or around 11% of the population, but they account for almost a third of the arrests. Some of the reasons behind that is that the distinct health needs are being ignored. These are the factors that are leading to those arrests, whether it's substance abuse, whether it's disorders and co-occurring disorders, or whether it's emotional and physical trauma. For those of us who are teaching undergrad, you could, with interactions with undergraduate, in college students, you can sense some of the struggles that emerging adults are struggling with. Can you imagine this being translated to those who have interactions with the criminal justice? So these underlying factors, lead those individuals to engage in criminal behavior, and these factors are not being addressed. Hence, you end up seeing recurring criminal activity and arrests. And in some instances, the criminal justice system is overwhelmed. It's not uncommon to see a large number of actually rearrests for the same individual. In some of the data we've seen, you can end up seeing somebody coming back and being arrested about 28, 30 times in a literally relatively short period of time. And the main reason is that those factors leading to those criminal activity are not being addressed. So the Transformative Justice Program is a program that was set up by a nonprofit organization based on academic literature and discussions that set up basically a first needs assessment to highlight and determine factors contributing to this criminal behavior at the individual level. From that, a case review team will determine this assessment and then suggest services to best address those factors. Now, those services are going to be community-based services. So there's no introduction of new services that do not exist in the community. That team will also devise what is known as an ICP, an individual care plan, for each individual, each participant, and that participant will go through the program. That program could last up to 18 months. Upon successful completion of the program, then the case review team will liaise with the county's criminal justice stakeholders and argue or push for an expungement of that arrest, in the hope that those underlying factors have been addressed and that recidivism and new criminal activity will not occur in the future. Now, for terms of the eligibility for the randomized control trial, any defendant between 17 and 24 years old arrested in Williamson County with an eligible offense. Williamson County is a county outside of Austin. It's in a city called Georgetown, Texas. And the eligible offenses are mainly non-violent felony offenses and drug-related offenses and so on and so forth. Not every offense is eligible, but we have defined a list of offenses that allow that participant to be eligible for the study. The selection enrollment process basically occurs immediately at arrest. The project manager and a defense attorney will meet with the defendant, and inform that defendant of the program, get their consent, and then through randomization assigns whether they will end up being in the treatment group or in the control group. We expect about 12 enrollees per month, and data collection will last for 1 year. The main outcomes of interest are recidivism, and we define recidivism in a few different ways, whether it's arrest within a specific period of time or whether it's conviction on a new criminal activity. And we will do robust and sensitivity checks there. Another main outcome will be health outcomes, and these are collected quarterly through quarterly surveys using SF-12. Other potential outcomes include employment, education attainment, and housing. Part of the program is some of those services will be provided, and we were hoping to be able to capture those changes over time. Now, in terms of data collection, we will acquire criminal justice data from the county to be able to follow the case and get disposition of the case and allow us to build a timeline to highlight and compute recidivism. We will also collect health data through quarterly survey with the baseline survey at enrollment, and then a quarterly survey after that for a year. I know the slide says up to 2 years, for 1 year. And there is monetary incentives for us to minimize attrition rates. These are emerging adults. It's a very mobile population. So one concern we had is attrition. We can also complement all of this with healthcare utilization data, employment data, and education attainment data. We're working with different entities and agencies in Texas and around Georgetown to get this data. And we have done a very good job in being able to identify the sources and what is possible in terms of data collection. And one slide about process eval, we will also basically do what is known as document analysis, structured interviews, focus group, and we can also directly observe many aspects of the program. And the goal is to identify factors associated with outcomes and identify how the system and the program change over time. Now, that was a very brief recap for what the study is about and the program. We are going to discuss some of the obstacles we faced when we were going through setting up and launching the study. The first obstacle was obviously, and that's something that is not new to anyone, is the IRB. We ended up having to go through a full board review. And the way we set up, because there's so many different components, we set it up with a shell application and then added multiple amendments to the application so we can actually increase our, I guess, success rate, or at least be able to argue clearly for each amendment. A main concern with initially that came up to us was the role of the district attorney in setting up eligibility of offenses. The IRB was not comfortable with having the list of eligible offenses being set up by the district attorney, because that means the district attorney is basically determining who's eligible and who's not, and affecting potential outcomes at the other end. We were able to overcome that with discussions between the district attorney and Lone Star Justice Alliance and the research team. So we were able to identify offenses and get some sort of an independence, and the IRB was okay with that process, but that had a significant delay. Another concern that actually also came up from the amendment is whether we can include 17-year-olds in the study. So the criminal justice system in Texas sees 17-year-old as adults, but the IRB does not. And this disconnect basically opened up the door for again, a lengthy debate, and we were unsuccessful in, basically arguing our case. So our sample will include 18-year-old. Part of the issue was for the 17-year-old to be present in the study, we will have to have consent from parents. And based on some of the literature we've seen and some of the discussions we've had with our partners, that would have been a very difficult task to accomplish. Now, once we were able to overcome these obstacles, and we were literally a few days from launch, the COVID-19 pandemic did shut down the program. And if you're following some of the news, there is a lot of concerns about how the virus spreads around in jail and prisons. So the county removed, just like any other county, removed all non-essential personnel from jail. So the program staff was not able to do any enrollment because they were not deemed essential. And that for a period of 2 or 3 months, as people were able to identify how the virus is spreading and some of the changes, we did not have access to program staff being in jail. Then on March also 29, 2020, the governor of Texas issued an executive order relating to detention and personal bond. One of the cornerstone of the project is that any defendant which gets allocated to the treatment group gets automatically a non-financial personal bond or a PR bond. Well, that executive order also changed some of that dynamic. So that was something that we had to deal with and address. A third obstacle from the pandemic is that the COVID-19 also put pressure on what are the eligible offenses, in the sense that now most counties were avoiding, or at least trying not to arrest those who did not deem potentially dangerous for the society, just to minimize having them in jail. And in fact, in some instances, some counties also release individuals to minimize population jail. So that was another concern that we had to also work through because it changed eligibility, and obviously the sample size and our power analysis. Another obstacle that was also due to COVID-19, those who were in the control group, because most of the eligible offenses are felonies, if they do not end up getting, if they go through the, the criminal justice system as is, they will potentially end up in the Texas Department of Criminal Justice as inmates. And part of the quarterly survey data, we had plans to either visit them every quarter to collect the data or call them over the phone to do so. Potentially, we considered sending them mail. The issue is that because of COVID-19, personal visits are not allowed. The phone system, per our discussions with the TDCJ, is overwhelmed with calls from families and relatives checking on their inmates and vice versa because of the COVID-19. And regular mail is actually not allowed. Regular mail is allowed, but self-addressed mail and monitoring centers were not allowed. So we're still working through some of those obstacles to identify the best way for us to reach the inmates who are in the control group. Those who are in the treatment groups, obviously, the program will have direct interactions with them. And part of the whole issue here is to make sure that we minimize attrition so we can get basically everyone who enrolled in the study. Another, so once we walk through most of those obstacles and find ways to address them, recently the county, Williamson County, decided to take the program management in-house rather than rely on Lone Star Justice Alliance or an external entity. And that's going to start literally in the next 2 weeks, so by the end of September. And the concern for us as a research team is obviously program fidelity, whether the program is going to stay exactly the same as it was designed, and that will impact obviously our research design. And we are currently working with the county on transition. We are hopeful that we'll be able to identify a good transition plan, and in the next 2 weeks identify any potential hurdles or obstacles so we can overcome them and launch the randomized control study soon. We feel that we've been ready at the different junctions, but then new obstacles actually came up literally out of nowhere. Now, progress to date, we have an IRB application approved with all amendments. We've done training for IRB training for program staff and randomization and research design. Everybody is ready. We've had all the documents and paperwork have been created, whether it's a research protocol, consent documents, all of this has been translated. And we have basically all the setup to launch ready. The main change that has taken us a while was to literally change all of the enrollment for the research study from in-person to virtual. And that was after the program staff were asked to leave the jail, we started working towards a virtual intake to accommodate all of the COVID-19 restrictions and obviously the uncertainty about the timelines. That included acquiring necessary approvals from county staff and officials and making sure that the IRB is okay with the virtual intake process rather than in person, and also make sure that the research design and the enrollment, all of it do not get affected by the new protocol. We were able to adjust the protocol and we have everything actually ready for a virtual intake, and we're very excited, and hopefully in our next webinar we will have launched and have new basically we have results and we can show you some of those next time. Thank you.
Okay, George, thanks for sharing. Now we will have commentary on the study from Jeff Burkhardt from the Texas Indigent Defense Commission. I'll pass it on to Jeff to introduce himself.
Great, thank you. Hey, good morning, everyone. My name is Jeff Burkhardt, and I'm the Executive Director of the Texas Indigent Defense Commission. TIDC, we basically fund, oversee, and improve public defense throughout the state of Texas. We have 254 counties here, and we work in every single one of those counties to improve public defense. On the funding part, we are one of the funders of this project, one of the collaborators on it. We normally fund things like new public defender offices or expansions of public defender offices, things like that. So how did we end up as part of this project? You know, although it has a defense component, it is a little bit of a different project for us, and we decided really it was worth funding because it holds so much promise. You know, I think you heard Dr. Nafal talking about a lot of the issues we see with young adults. And not only do we have research on that, I think all of us on this call, I think you know at a gut level that age, I mean, we've all gone through that young adult status. And when you're at that age, it's a really big turning point. And again, as Dr. Nafal pointed out, I mean, the research really backs this up. It's a huge turning point. You know, I think the statistic that he brought up that really pops out is that even though they only make about 10 or 11% of the population of Texas, they're taking up about 29% of jail beds and prison beds. I mean, that's a eye-popping statistic. So what's our involvement with this? I mean, you know, one of the reasons that we're looking more and more at this sort of work is that public defense has been evolving over time. We're talking increasingly about something called holistic defense, where public defenders, private attorneys, they're really representing the whole individual and not just looking at the criminal case, but looking at things like mental health issues, looking at things like homelessness or drug addiction. And that's what was really appealing about this study. A lot of the thinking behind the study came from a book written by a professor at University of Texas named Bill Kelly. And if you get a chance, I really recommend Bill Kelly's work, definitely worth looking into. And I think at the Texas Indigent Defense Commission, we're just fascinated to see what happens with this project. Not just from a defense standpoint, but just what happens to the young adults involved in this. A couple last things I would mention real quick. Even though we're an indigent defense-based state agency, you know, we're focused on public defenders and public defense. The clients we work with don't experience this or don't experience the criminal justice system in a vacuum. You know, they experience this as part of many other things going on in their lives. It could be eviction or drug addiction or mental health issues, all kinds of co-occurring problems. And so we are deeply invested in this project. We're very excited to see what the outcomes are. We're very excited to partner. You know, we actually partner with Texas A&M on quite a few different projects. So we're always excited to partner with them. And we hope to see what comes from this project and see if we can replicate it in other parts of Texas. Thank you.
Thank you so much for your commentary, Jeff, and thank you to the presenters as well. So now with this latter half of this webinar, we'll be fielding some questions from the audience. So we'll give you a few minutes to add any questions or thoughts to the Q&A box. And then I'll direct those questions to the presenters.
Chris, I can address one question that came to me via email, and it's in the chat box. So the question was, do you know the rate of lead poisoning among the young adults in the study, and did you consider this factor in your analysis? The short answer is no. We do not know the rate of lead poisoning among our potential, basically, young adults. This is a very interesting question, but it would require, if this is mentioned in terms of child, lead poisoning occurring in children, we would probably need a longitudinal data set to identify and follow those children throughout their adulthood and emerging population status. So we do not, and it's something that we did not consider in the study, but it's something that I will do a little bit more research on, and see if that's that's something we may discuss among the team. But it's a good question, and so far we do not have that.
Can I add something real quick? That's I think just a fascinating question. There's actually a defense attorney in Houston who, as part of some of her closing arguments, has used maps of lead poisoning in different parts of the Houston area, and to show where defendants are really coming from, and drawing that kind of connection. And I think there's a lot more work that needs to be done in that area. That's a fascinating question.
Awesome. And this question is for George. Can you talk about what scaling up an intervention like this would look like, and what systems issues would need to be addressed?
And that's a great question. So we are, part of the reason of using existing services is to allow for this potential of scaling up, in the sense that in other areas they would be able to look at internally what services exist in the community. Now, the program is not designed to be replicated in other areas, in terms of some services may not exist in other regions or other cities. We are working on a pilot study in Dallas with a similar project design and services, whatever services exist in Dallas. So the idea is, why would a question potentially be, why they were not already responsive? There is a disconnect between the county and the criminal justice system and community services. Part of the appeal of the program is actually connect those dots and connect those and allow for cooperation among them. And in many instances, the criminal justice system just is not aware of those existing services. And in terms of recent changes, there is a concern about what is basically available and what's not available. A lot of those services in the community are provided by nonprofit organizations who have been affected badly by changes in economic conditions due to the pandemic. So that's something that we're actually also following closely, just to make sure that the key services that we're looking at are still offered, and they still basically are provided.
And that kind of dovetails with a question from Jean McGuire, who noted that there are no new services that would be offered, but they'll be connected to already existing services. Will there be enough capacity in the existing ones, and why were they not already responsive?
Yeah, so we have no indication that there would be not enough capacity in the existing ones. Why they were not already responsive is because of the lack of cooperation and connecting. So there was no match. The services were not aware that there's a need in the criminal justice, and the criminal justice system was not aware that those services could potentially help. So it's connecting both. It's making sure that you track the information and hopefully show that there is an actual positive outcome, and not just in terms of lowering recidivism, improving health outcomes, but perhaps also in terms of cost savings for the county and also the community at large.
Good response. Samantha would like to know, how do you define transformative justice, and how are you centering race in your analysis? And I'll direct that to both of you, actually. So
in terms of transformative justice, so basically, I guess at the core, instead of just immediately somebody getting arrested, going into the process by basically most likely getting denied a non-financial bail, maybe being offered a financial bail in Texas. A financial, anybody who has enough money can get out. Then they would end up most likely not being able to pay it and spend the first day or 2 or 3 in jail, and even more, even beyond that. So the transformative justice is that basically the default will be to offer this non-financial bail, allow that individual to work on those underlying factors and hopefully address the problem at its core. Now, the objective is that's a start for those potential eligible offenses. If good outcomes, if things seems to be working in the right direction, I think there is enough support that potentially further offenses and more eligible offenses will be added to perhaps not this study, but also other locations. Now, how are we centering race in our analysis? We're obviously collecting demographics. A lot of those individuals are homeless. They don't have families and homes to go to. We are gonna, given the current environment around the nation, we are going to examine different impacts by different, the magnitude of the impact by different groups, and see if some of those, by examining also the process eval, seeing if some of those factors are helping different groups in a different way. All of this will depend, unfortunately, also on the number of offenses and number of participants in our study to allow us to be able to make some of those inferences.
I did only that to tie this back to the last question about why were those community services not already identifying young adults and providing those services. That part of that's what I think makes this program transformative. I mean, we have these programs these community-based services that exist, and then we have a criminal justice system that really is, it processes people in a very specific way. And it's a way that oftentimes is kind of blind to other rehabilitative or community-based services that might be helpful. The criminal justice system, when you get somebody who's arrested, then the next step is magistration, and then after that they show up for arraignment, and they get an attorney, and then 98% of the cases plead out, and that's the case. And then you move on, and then we see these high rates of recidivism, and that system just kind of keeps on churning. It hasn't really been designed for the most part to connect people with services like that, and I think that's what's transformative about this.
Thank you for those responses. And we have a question from David that kind of reflects a few questions that came to mind for me when thinking about young adults involved with the criminal justice system who are resistant to accepting help from social services, especially when compared, say, to older adults. What are any strategies that you have in mind that might increase engagement among those young adults?
So that's a good question, but us being more on the research side and the research team, we are not involved heavily or in day-to-day program activities. But some of the discussions we've had with the program staff and throughout the last few months, we know that there's going to be an intense case management focusing at the individual level for each participant, identifying the crises and being able to address these, and not just address them in the sense that just address them at the moment, but also provide skills to teach independence so they can actually become independent of the program, become somebody who hopefully will not come back to the criminal justice or not be involved in the criminal justice in the future.
And Harry would like to know if there's drug addiction homelessness or any other factor that may have caused criminal behavior. Can you walk us through, what happens to those young adults?
Yes, and actually, yeah, that's really at the center of the program. So any drug addiction, homelessness, or will be addressed through the program. There will be caseworkers, and there will be health interventions, and we're working with transportation and housing. The program is working with transportation, housing authorities to get those addressed, and it's basically an alternative rehabilitation program, basically, rather than staying in jail. And there's also empirical evidence that anybody who stays at least 2 or 3 days in jail is much more likely to commit another crime in the future and engage in criminal activity. So that initial also 2 or 3 days in jail is crucial for predicting future criminal activity. So yes, the answer to that is yes.
I'd add only that, I think Dr. Fall is exactly right. I'd add that a couple things. I think one, we talked a little bit about holistic defense and the idea that you're representing a person, not just in this criminal offense, but identifying those other things that are driving recidivism, the things that are kind of dragging this person down in their life. Another concept of this I think this research is really related to something that we see, we don't see very much in Texas, frankly, but we've seen in other states, which is ATI, or Alternatives to Incarceration. And I think this program very much kind of plays into that. And what's fascinating, I think, about this, the issues of drug addiction and homelessness and mental health, I think we're very fortunate. This has really been one of the few areas where we can see in this day and age a bipartisan push. If you look at Attorney General Barr's comments in recent months, he's talked about how, in fact, police aren't always the best answer to mental health problems and to addiction, to homelessness. And certainly that dovetails pretty well with people talking about this on the left. I think this program really kind of threads the needle politically. I think it provides something that's a really practical solution. And as Mr. Reed points out, keeping people out of jail, so that alone's a big deal. And I think Dr. Fall mentioned this. There is a program, a nationwide program that started years back called 3 Days Count, playing off of that research that just 3 days, and in fact even 1 or 2 days in jail, can increase recidivism. It really has a big effect on people's lives. So I think this is exactly where this program sits and why it's so important.
Thank you for those responses. And we also have a note from Reagan Walsh. Not so much a question, more short a statement building on the lead poisoning and longitudinal studies that we referenced earlier. So Reagan says that while this will be a good prospective study in the city of Milwaukee, the researchers were able to assess lead poisoning before age 3, then look at suspension rates in those children in 4th grade. Suspension rates and aggressive behavior was 3 times more likely for children with early lead exposure. Please consider this as a factor affecting outcomes. Did either of you want to riff on that a bit?
I don't know, Jeff, do you have anything to say? I think I'm gonna look more into this and whether we can incorporate this in the study. I'll have to talk to the research partners.
Awesome.
Yeah, whether it's this study or something else, I think Reagan has a really good point. I mentioned there's that Houston attorney who's been studying this a little bit and using some of this in closing arguments. But I think that the point that Ms. Walsh brings up is kind of goes back to, again, to that when we're talking about our clients going through the criminal justice system, they don't experience the criminal justice system in isolation, that all these things are intersectional, that, it's driven by many different things. Could be mental health issues, could be homelessness issues. It could be environmental factors like lead poisoning, human-caused environmental factors. So I think it's a very good point, and whether it's this study or another, I think it's something we need to look into a great deal more, that intersection between these environmental factors, including lead poisoning, and criminal justice system.
Great, and we got one last question from Raina, and we still have a little bit more time, so if folks have additional questions they want to ask, please do so. But Raina would like to know how participants were recruited. Was there a survey or questionnaire distributed to gain information about their needs, for example?
So that's a good question. So when somebody gets arrested and booked at the jail, the program staff will identify whether that offense is a part of the eligible offenses, part of the list. And once that happens, we identify that individual as somebody who is eligible to the study. Then a program manager, along with an attorney, meet with that participant, discuss the program and the study, and offer a written consent. Then upon the consent, the person is randomized whether in the control or the treatment group, and a baseline survey is administered. We have the contact information, and then 3 months later we do a follow-up survey, and then 3 months later we do a follow-up survey. So that's basically how those individuals are recruited.
Great, and if there aren't any other questions, I want to extend our thanks to George and Jeff for walking us through this very timely and interesting study. And we look forward to hearing from you again in the near future, so we can be brought up to speed on any findings that will come of this.
Happy to be part of the project. Thanks for having us here today.
Thank you.
Fantastic, fantastic. And of course, if anyone wants a certificate of completion for today's ResPark webinar, please complete the survey at the end of the session. It'll pop up automatically. One will also be emailed to you as well, and we'll get that certificate to you as soon as possible. And if you're interested in upcoming webinars, just like this one, same place, same time, September 30th, we'll be hearing from a research team out of Ohio State University, led by Alicia Bunger. She'll talk about using regional governing boards to align services for rural children of the opioid crisis. And on October 14th, we'll be hearing from a team at Benefits Data Trust, led by Ashley Humani, and they'll discuss connecting vulnerable seniors to nutrition assistance through a managed care plan. Both very exciting studies, and we hope that you will be able to join us for those discussions as well. And of course, Systems for Action is a national program office of the Robert Wood Johnson Foundation, and we'd like to thank them for making this possible as well. And with that, we will see you September 30th. Take care.